Hello and a very good morning to everyone. Welcome to today's session on early pregnancy, common queries, myths and facts by Apollo Cradle and Children's Hospital. We would like to welcome Dr. Anjali Taneja, who is an in-house obstetrics and gynecology consultant. She holds a degree in MBBS, MD in obstetrics and gynecology, FMAS and MRCOG. We welcome you, Doctor. You can now take over the session.
Thank you. So, greetings everybody. I'm Dr. Anjali Taneja and I'm consultant and attached to Apollo Cradle Hospital, Indrapuram. So, congratulations. You all are going to be proud parents, and a living being is created in you, and whatever you eat or do is going to have an effect on it. So, here we are. We are going to talk and discuss, and it's an open forum. Feel free to ask whatever queries you may have after this session. And we're going to discuss about the common early pregnancy myths, queries, put forward some facts that we may have once we start onto this glorious journey. So we have done the pregnancy test and two red lines are seen and it brings forth a lot of joy, but simultaneously it brings out anxiety also because it's a new journey, road which is untraveled so far, and so comes a lot of questions. What is going to happen? So here I am trying to sort out some common questions, some common queries, which probably many patients have asked us during our clinical experience. And still, if you are left with any more queries, we'll be happy to take up those queries in the end of the session. So let's start. So to begin with, the pregnancy is divided into three parts. The first part or trimester is the first 3 months of the pregnancy, and it starts with the day you had your last period. The first day of your last period is the timing that we start calculating the beginning of your pregnancy, and it lasts up till the 13 weeks. This is the time when the formation of body parts of the baby occur. So the important thing here to note is that even before you miss your periods, the changes of pregnancy and the formation of baby has already started in the body. So it is important to adopt a healthy lifestyle while planning pregnancy. Any uncontrolled medication, unsupervised medication or uncontrolled medical conditions, alcohol intake, smoking, active or passive, can be detrimental around that time. It's a good practice to take folic acid and get few preconceptional, that is few tests or few checkups done with when that you're planning pregnancy. That is when you're not pregnant but planning it. Preconceptional tests done when planning pregnancy to ensure that you are in the best of the health when you are getting pregnant. Once tested positive, it is good to make an appointment as soon as possible to ensure best care plan for you and your baby. Many a times we think that okay, we have just tested positive, अभी तो कुछ है नहीं, चले जाएंगे डॉक्टर के पास, 3 महीने बाद जाएंगे. It's not like that. See, we have to understand that the major body formation, the major part of the body, baby's body, are formed in the initial 3 months. So a lot is going on. So initial 3 months are very important. So you must visit your doctor as soon as you test positive so that the best care plan is formed for you. The risk factors are identified and the optimal care is given for you and your baby, right? So what happens when you go to the doctor? What will happen? The doctor is going to ask your history in detail, identify any risk factors that you may have, prescribe some medicines, which usually includes folic acids, advise an ultrasound to check for the heartbeat and the baby's well-being, and some blood tests are done. Now, after this, a detailed discussion ensues, and many a times, कभी time नहीं होता, कभी एक हिचक होती है हमें क्वेश्चंस पूछने में, कभी हम पूछते पूछते रह जाते हैं, भूल जाते हैं, उस टाइम पर पूछ नहीं पाते हैं, और कुछ चीजें हमें लगता है पूछनी थी पर रह गई, चलो अगली बार पूछ लेंगे. And so there are many things that come and keep on coming out to mind. फिर हमें कोई कुछ कह देता है, फिर एक और चीज आ जाती है, अच्छा ये खाना है, वो नहीं खाना है, ये काम करूं या नहीं करूं. So here we are now starting our journey and trying to address your common queries. So during initial stages, you will be commonly prescribed a very small yellow colored pill, the folic acid. So why you should be taking it? मैं क्यों खाऊं ये गोली? Because it is a routine supplement given to all pregnant females and it is required. It is a small vitamin required for the baby's spine to develop. Spine is the backbone. It is required for baby's skull, the head bone, and the spine to develop optimally. So you must take it. Often the females will come back. मुझे बहुत थका हुआ लगता है, मैं तो काम ही नहीं कर पाती. The husband will say ये सोती रहती है, आजकल ये बहुत सोने लग गई है. So you may not have had your baby bump as of now. Nothing may be visible. But a lot is going on inside your body. After all, you're creating an entire living being. बहुत काम हो रहा है. So feeling tired, feeling sleepy is particularly marked in early parts of pregnancy and it can be normal. It can be due to hormonal changes. It can be due to anti-nausea medicines that you may be getting. So take adequate rest. Listen to your body. If you feel tired, do take rest and stay hydrated. Try to drink plenty of water and remain stress free. Next, very common query. Doctor, do I need to eat for two? मुझे क्या 2 लोगों के लिए खाना है? No. There is absolutely nothing like eating for two. So, though there is nothing like eating for two, you definitely need to eat a bit more. Because आप जो खा रहे हैं वही न्यूट्रिशन और उसी से एनर्जी यूज हो रही है बच्चे का ग्रोथ के लिए और बच्चे के फॉर्मेशन के लिए. So your body is actually using the energy and nutrients from the food you eat to grow a baby. So on an average, you need 400 calories a day more. This amount can vary depending on your pre-pregnancy weight. Somebody who was underweight can need more calories. Somebody who was already on the higher side of the weighing scale may not be needing too much, and उसके लिए बहुत ज़्यादा weight gain may not be a good situation. Because too much of weight gain is also not good. Why? One, extra weight gain means higher chances of having medical complications in pregnancy, like higher chances of diabetes in pregnancy, higher chances of developing high BP in pregnancy. Then there is a condition जिसमें आपके लेग्स में ब्लड क्लॉटिंग हो सकती है. उसकी संभावना भी आपका वेट बढ़ने के साथ साथ बढ़ जाती है. Excessive weight can be difficult to shed off in a postpartum period. डिलीवरी के बाद ये वेट जाने की में दिक्कत आ सकती है. So it's a good thing to have a reasonable weight gain. A reasonable strategy could be eating small frequent meals, maybe 3 meals and 3 snacks. That will help in one, avoiding prolonged fasting intervals, which will help with acidity in pregnancy. Again, which is another common complaint कि मुझे बहुत acid बनता है, तो बहुत ज्यादा देर आप fasting ना रहें. It helps with stable sugar levels. So बहुत देर fasting नहीं रहेंगे तो आपका blood sugar stable रहेगा, essential nutrients मिलेंगे. High calorie, low nutrient, high sugar snacks को avoid करें. So snacking के लिए आप healthy options choose करें, like makhana could be one option, peanuts could be one option. So choose healthy and remember to take plenty of oral fluids. Eggs can be options. Then you can have whole grains, dry fruits. The jaggery can be option in winters, which is a very rich source of iron. Okay, we just had Karwa Chauth passing by, and lot of females had a question: can I color my hair? So the good news is that chemicals in the permanent or semi-permanent hair dyes are not highly toxic, and most research, although limited, shows it is safe to color your hair while pregnant. So, but the key word here is that the research is not too much, the research is limited. So as a mother, we may choose कि भाई शुरू का 3 महीना जब मेरा बच्चे का फॉर्मेशन हो रहा है, मैं कलर नहीं करूंगी, या मैं सिर्फ स्ट्रीकिंग करा लूंगी, या मैं वेजिटेबल डाइज यूज कर सकती हूँ, मैं इंडिगो बेस्ड या मैं हिना यूज कर सकती हूँ. एंड आफ्टर दैट आई रिक्वायर्ड और इफ आई एम टू कीन आई कैन गो फॉर सेमी परमानेंट हेयर डाइज. So you may decide to wait to dye your hair until after 12 weeks of pregnancy, when the risk of chemical substances harming the baby is much lower. If you're coloring your hair yourself, if you're going to do it yourself, you can further decrease the risk by using gloves. Do it in a well ventilated room. Leave the dye for a minimum time and rinse the scalp once the dye is applied and done. So maintain for it for a limited time and try to avoid near scalp so that the absorption is less. And then henna, of course, is a safer alternative. Another query, can I take sugar sweeteners? Okay, so generally we say sugar sweeteners are not safe, don't take it. So when I actually searched out, FSSAI in India has actually allowed aspartame to be approved in pregnancy. For somebody who is already diabetic or develops diabetes in pregnancy can take aspartame within the regulatory limits. The limit being 40 to 50 milligram per kg. The side effects of aspartame being headache. So take it only if you really want to take something sweet and take it within the regulatory limits. The available data does not show any increased risk of toxicity or any adverse pregnancy outcomes. बहुत बार हमें लगता है कि नेचुरल प्रोडक्ट्स जो हैं, प्लांट बेस्ड प्रोडक्ट्स जो हैं, वो हमेशा ही सेफ हैं. So stevia is one of the plant based sugar sweeteners, but as of now whole wheat stevia and unrefined stevia extract is not considered safe by FDA in pregnancy. So avoid stevia in pregnancy. जो हमारी शुगर कैंडीज हैं, शुगर फ्री कैंडीज में सॉर्बिटॉल एंड xylitol है, दैट इज अगेन कंसिडर्ड सेफ. सो यू कैन हैव शुगर फ्री कैंडीज एंड शुगर फ्री च्युइंग गम्स और जो उनमें स्वीटनेस है दैट इज सेफ. एस्पार्टेम इज अवेलेबल इन द मार्केट एज इक्वल. जो इंडिया में हमारा ब्रांड है दैट इज इक्वल. स्टीविया इज नॉट सेफ एज ऑफ नाउ. ओके, नेक्स्ट. Another very, very common question, can I fly? Can I travel? Doctor, मुझे जाना है. मेरा traveling can be for various reasons. Usually personal reasons, sometimes occupational reasons. You may be a part of aviation industry. You may need to fly. So traveling throughout pregnancy, traveling in early pregnancy. So what are the recommendations? In early pregnancy, traveling will not add extra risk. So what is meant by extra risk? So baseline risk in early pregnancy is basically of miscarriage and that of an abnormal pregnancy, that is ectopic. Now what we need to understand is कि अगर 100 लोग कंसीव होते हैं, अनफॉर्चुनेटली उनमें से 15 will abort for various reasons. 85 pregnancies will continue generally. So by traveling, the risk is not increased unless there is already an increased risk or there is some other complication, medical or obstetric. So in an uncomplicated pregnancy, travel is not increasing your risk. So in early pregnancy, it is advisable that we get your risk assessment if your pregnancy is otherwise low risk. The heartbeat is already visible on your ultrasound. It has already been documented that your pregnancy is viable. It has heartbeat is there and it is normal going pregnancy. Ectopic has been ruled out that it is normal. Then traveling will not add extra risk. For the remaining part of the pregnancy, again, in the absence of obstetric or medical complications, that is, you don't have any pregnancy related or any other preceding medical problem, air travel is generally safe for pregnant women. They can fly safely, observing the same precautions for air travel as for general population. But because air turbulence cannot be predicted, and in case of any trauma, the risk is more. So they are advised to wear seatbelt throughout the journey. And the seatbelt is to be worn below the hip bone, below the baby bump, and they have to wear the seatbelt throughout the journey. So they have to be slightly more cautious. Then, to maintain comfort during the journey, the pregnant female can choose to avoid any gas producing drinks like carbonated drinks just prior to the travel, because these gases can get entrapped and then they can tend to expand at higher altitudes. So that can cause a lot of discomfort. Now, in prolonged travels, there can be leg swelling, or sometimes there's a risk of again blood clotting in the legs. So to decrease that, if it's a long travel, you can use stockings. So you can discuss with your care provider with respect to that, and tight stockings can be provided. And maintain hydration, use occasional ambulation, try to choose a aisle seat, and avoid any alcohol intake. And this is for travelers who are traveling occasionally. That is, one or twice you have to travel in pregnancy for to here and there. But what about occupational travelers? So for them, there is a risk of cosmic radiation. So the air crew and frequent flyers may exceed these limits. So for them, definitely there are guidelines, and there's a separate topic altogether. So that is not a part of domain for this live session. However, if any patient or any female who is a part of aviation industry who is frequent flyer attending this session must consider this hazard, and should check with their should check with the guidelines and the rules applicable if they get pregnant. Other thing is that another concern that patients do have is that I'll be passing through the body scanners. So will they cause any harm to my baby because they'll be using radiation? There'll be almost 2 to 3 scanners that a pregnant patient may go through while boarding a flight. So no, the radiation used in these scanners is very low and it does not cause any harm to you or your baby. So it is safe to go through these scanners, and there is no reason to avoid these scanners, right? Other thing that you will need to check while traveling is that most airlines may not allow to fly beyond 36 weeks. In case of twins, probably after 32 weeks. They may need a certificate with respect to your due date from your treating obstetrician. So you will need to check with the airline with respect to those rules before you fly. So, and then there are some contraindications. Some patients who should not fly. If you have a hemoglobin of less than 7.5, you will not fly. If you've had a recent bleeding or a recent ear infection, heart disease, recent surgery or any tummy surgery, then these patients should not fly. So, in a nutshell, in early pregnancy, if there is no specific in early pregnancy, if the heartbeat has been documented, आपका बच्चे का heartbeat आ चुका है, उसका site documented है कि वो बच्चेदानी के अंदर है, ectopic has been ruled out, more or less it is safe to travel. आप travel कर सकते हैं. In later part of the pregnancy, अगर कोई complicating factor नहीं है तो आप travel कर सकते हैं. During travel, you can go through the scanners, have an AL seat, keep yourself hydrated, move your limbs, move your lower limb to reduce the risk of blood clotting, and maintain good fluid intake. Okay, coming to the next question. Can I have sex? Yes, in an uncomplicated pregnancy, if you're physically comfortable and you feel okay, yes, you can have. Can I exercise in pregnancy? Yes, regular exercise is in fact safe and beneficial in pregnancy unless there is a high risk and you have been told by your doctor not to exercise. रेगुलर एक्सरसाइज से प्रेगनेंसी में कॉम्प्लिकेशंस का रिस्क कम होता है। मेडिकल कॉम्प्लिकेशंस लाइक डायबिटीज, हाई बीपी का रिस्क कम होता है। ये बैक एक को कम करती है, कॉन्स्टिपेशन को कम करती है, वेट गेन एक्सेसिव को रोकती है, स्लीप को इम्प्रूव करती है एंड मूड चेंजेस को अच्छा कर देती है। बट यू मस्ट चेक विद योर डॉक्टर टू मेक श्योर दैट योर एक्सरसाइज रूटीन इज सेफ। कितनी एक्सरसाइज करें? ट्राई टू एम फॉर 150 मिनट्स पर वीक। बहुत ज्यादा लगता है पर है नहीं। सो इफ यू एक्चुअली डिवाइडेड इनटू 15 मिनट्स ट्वाइस अ डे, सुबह 15 मिनट वॉक करी, शाम को 15 मिनट वॉक करी, थोड़ा सा स्ट्रेचिंग किया, 5 डेज भी करेंगे। 2 दिन नहीं हो पाया, वेदर अच्छा नहीं था, मन नहीं किया, कुछ कुछ भी रीजन था, लेट हो गए, 5 डेज भी करेंगे वीक में तो भी 150 मिनट्स हो जाता है हर हफ्ते में। So try to aim for 150 minutes of exercise per week. If you feel uncomfortable, breathlessness feel हो रही है, heated लग रहा है, overeating लग रही है, stop. Any unusual pain, stop. So must stop exercising if you're feeling uncomfortable. Do not overheat yourself and stay well hydrated. How much weight gain is okay? So somewhere between 9 to 15 kgs is okay. But again, this will also depend on your pre-pregnancy weight. Somebody who is already obese to start with should not be gaining too much. Somebody who is underweight, the weight gain can be on the higher side. Then patients often come in early pregnancy with a complaint that I am vomiting a lot these days, I am just not able to eat, मैं खा ही नहीं पा रही हूँ, पूरा पूरा दिन मैं रोटी नहीं खा पाती हूँ. So nausea and vomiting in pregnancy, especially in the early part of the pregnancy, the initial 3 months is normal. Though it is called as morning sickness, it can happen throughout the day. It can happen in any part of the day. ये सुबह, दोपहर, शाम, रात कभी भी हो सकती है, चाहे इसका नाम मॉर्निंग सिकनेस है. So what can you do to help yourself? Try eating small frequent meals. Empty stomach नहीं रहें, थोड़ा थोड़ा small portions खाते रहें. बहुत मिर्च, बहुत ऑयली चीजें अवॉइड करें. Ginger can be helpful as a household remedy. You may be prescribed anti-nausea medication. जो डॉक्टर से हम आपको दवाइयां देते हैं, that can be helpful. Despite household remedy, medication, and dietary advice, there will be a small proportion of females who will still have a lot of vomiting, and symptoms can be severe enough to need hospitalization also. This is what we call as hyperemesis gravidarum. बहुत कम females को होता है, but it can happen. So if there are days when you feel you have just not been able to eat, dehydration हो रहा है, पानी तक नहीं पिया जा रहा, don't ignore your symptoms and do contact your doctor. However, majority of the patients will be able to sail through this time by understanding their symptom, helping themselves with dietary measures and a bit of medication. Eating things which make your mouth dry, which dry out the saliva, like a toasted bread. ब्रेड को बहुत अच्छे से कड़क सेक लीजिए, और रस हेल्प्स. जिस टाइम पर आपको नोजिया ज्यादा हो रहा है, उस टाइम पर बहुत ज्यादा वॉल्यूम वाली चीजें, लिक्विड चीजें जैसे दाल, सूप, वाटर, वो आप अवॉइड करें. उस टाइम पर आप थोड़े ड्रायर चीजें लें, दैट हेल्प्स. सो होप दिस हेल्प्स यू. Okay, another very common query. Will the color of my baby be dependent on the food I eat? A lot of females eat coconut. So they ask, will the color of my baby be dependent on the food that I'm eating? So no. The color of the food that you're eating is not going to decide the color of the baby. The color of the baby is decided by the genes that you and your partner have already transferred to the baby at the time of the conception. So the moment the baby was conceived, the genes were transferred and the color was already decided. So the color is irrespective of whatever food choices or cultural choices you can have. So it is irrespective. Another common complaint that patients have is constipation. So what can I do for constipation? अगेन बिकॉज ऑफ द हार्मोनल चेंजेस, प्रेगनेंसी में जो हार्मोन्स बढ़ जाते हैं वो हमारा बाउल मूवमेंट को कम कर देते हैं। देन आयरन इनटेक होता है, विटामिन इनटेक जो होता है प्रेगनेंसी में, मूवमेंट कम हो जाती है, वुम धीरे धीरे ग्रो करने लगता है विच compresses ऑन द bowel. So all these factors contribute, and because of this constipation होना शुरू हो जाता है, which is quite common in pregnancy. So what can you do to help yourself? Again, eat healthy fiber rich diet, increase your water intake, very important. A lot of females, a lot of patients do not drink water adequately. So make a conscious effort to drink water, such a simple remedy. Identify your bottles in the morning, identify at least 3 bottles कि मुझे आज दिन में ये पानी पीना है, सिर्फ पानी ही पीना है, पानी, नारियल पानी, शिकंजी, whatever form, आप पानी को किसी तरीके से पीजिए. And exercise regularly. Aim for 150 minutes of exercise in a week. So these tips should help you. Still, again, few females may need medication. Many safe medications are available. If required, they can be prescribed by your treating obstetrician. So, what is the best sleeping position in pregnancy? मैं कैसे सोऊं? मैं किसी भी position में सोऊं or do I need to change it? Sleeping position straight on your back may not be very good position after 4th month in your pregnancy. So try sleeping onto the side, preferably onto your left side, that is the left shoulder down. That is what we call as left lateral position. Why? Because the hard part, the bone, the backbone runs onto your back, and the major vessel, the aorta, also runs in front of it. So when you lie on your back, the aorta gets compressed between the growing womb and your backbone. So there are few studies which have said that it can affect the blood supply to your baby. So it is more advisable that you sleep onto your side and preferably to your left side. Another query that females have is, can I eat fish in pregnancy? So some fishes are contaminated with mercury, a metal that is linked with birth defects. So avoid shark, swordfish, king mackerel, and marlin. Do not eat raw fish. You can eat fish while pregnant. 2 to 3 serving per week is okay, but do not overdo. Can I take alcohol? So no, absolute no. No amount of alcohol is safe in or around the time when you're planning pregnancy. It has been shown to cause physical, emotional, and behavioral changes in pregnancy in the baby. So it's a strict no. Can I take coffee, tea or coffee? So you have to limit your intake of caffeine to 200 milligram per day. Now, how to measure this 200 milligram per day? Very difficult. It is practically 2 small cups of coffee per day. Now, my small cup can be different from your small cup. If I was drinking this cup prior to pregnancy, my small cup will be this. If you were drinking this small cup of coffee prior to pregnancy, your small cup will be this. So maybe we can take once in a while. I can have whoever is pregnant can have 1 small cup of coffee if you really like it. But then also remember, caffeine is present in your soft drinks also. Caffeine is present in dark chocolates. Caffeine is present in green tea also. Caffeine is present in Coke. Caffeine is present in many other things. So do check the label ingredients to check for the presence of caffeine. Usually the label will have the ingredients and the amount. So the amount you have to limit is 200 milligram per day. Another common query is, Doctor, मेरा weight नहीं बढ़ रहा. So what to do about it? So the weight gain typically starts after first trimester. Many patients will actually not start gaining weight till 4th month. Some patients can lose weight also. कुछ patients का weight 3-3 किलो भी कम हो जाता है by the end of first trimester. That is okay. You will gain weight. The weight gain starts typically after 4th trimester, चौथे महीने 4th month. That is okay. कोई बात नहीं. That is normal. So is there anything that I have to avoid कि मुझे करना ही नहीं है? So avoid self medication. आपने अपने आप से बिना पूछे अपने डॉक्टर से कोई दवाई नहीं खानी है. अनकुक्ड रॉ फूड नहीं खाना है। अगर आपके पास कैट एज पेट्स हैं, आपने कैट लिटर नहीं क्लीन करना है, दैट कैन ट्रांसमिट अ डिजीज कॉल्ड टॉक्सोप्लाज्मोसिस। स्मोकिंग अल्कोहल, नो। ओवर द काउंटर एंटी एक्ने क्रीम्स, एक्ने एंड ऑयली स्किन आर अगेन कॉमन इन प्रेगनेंसी। तो आपने ओवर द काउंटर जो एंटी एक्ने क्रीम्स कई बार ले लेते हैं हम, उसमें एक कंपाउंड होता है रेटिनॉल, विच अगेन कैन कॉज बर्थ डिफेक्ट्स इन द बेबी। सो वो बिल्कुल नहीं लेना है। एंड इन केस यू आर गोइंग टू स्किन डॉक्टर, डर्मेटोलॉजिस्ट फॉर दैट, उनको भी आपने इन्फॉर्म करना है दैट यू आर प्लानिंग प्रेगनेंसी और यू आर ऑलरेडी प्रेग्नेंट, सो दैट any cream containing retinol is not prescribed to you. Then how many visits कि डॉक्टर ओके माई ऑल क्वेरीज आर सॉर्टेड, अभी मुझे आपके पास कब आना है और मुझे कितनी फ्रिक्वेंटली आना पड़ेगा, मैं तो बहुत बिजी हूँ, मेरे पास नहीं है बार बार टाइम आने का। सो नो, आपको बार बार आने की जरूरत नहीं होती है। यू विल बी कॉल्ड ओनली वंस अ मंथ unless there's some problem or some complication identified. You'll be called only once a month till around 28 weeks of your pregnancy. Once the baby grows up to 28 weeks, then you are called twice a month, and then you are called weekly till your delivery. So, but more frequent visits may be required if you have any medical or any obstetric problem during pregnancy. So this was about it. I have tried to cover more all the questions that I could think of that patients usually ask when they come for their initial visits. We are open to questions. If there are any queries that are coming up, I'll be happy to take them.
Yeah, hi doctor. So you've
Hi.
covered a really long range of questions. So kind of lots of questions that have been asked. You've actually already addressed. There's few that's missed out. I'm just reading that out to you, doctor. So first question was that can you determine the gender of the baby by heart rate or appearance of the belly?
No, we cannot determine the gender of the baby by heart rate or appearance of the belly. No, it's not possible.
It's not possible. All right. The next question is, doctor, are COVID-19 vaccines safe for pregnant women or women who are going to plan their pregnancy?
Yes, they are safe.
All right.
Both Covaxin and Covishield are approved in India, and you can go with them.
All
They are
right.
safe in all trimesters.
All right. So they won't result in any side effects or any such thing. There would be no
Long-term
complication.
data we do not have for these vaccines, but the short-term data which is available, already more than 1 lakh females across the world have already taken these vaccines, shows that they are safe and they're already approved, and we're already recommending our female patients to take them. Many of my own patients have already taken them, they've all delivered, and they're doing good.
All right. The last
So we
and
do
final
recommend it.
Sorry, doctor. Yeah, please go ahead.
That's okay.
So the last and final question before we conclude today's session is, doctor, are there any foods that need to be avoided during pregnancy?
Are there
any food sections which are to be avoided during pregnancy?
anything which is raw or uncooked is not to be taken. Then I listed the fish, the overall quantity of fish I told not to be taken. Then the kind of fish I've already told which are not to be taken. Then unripe papaya is not to be taken. Then there's a very strong myth about papaya. Ripe papaya in moderate quantity you can take, but unripe papaya is not to be taken. Otherwise, no other myth.
All right. Would you like to say anything before we conclude today's session, doctor?
Wishing everybody a happy and safe pregnancy. It's a journey, it's not an illness. So enjoy your pregnancy. Feel free to ask your queries to your obstetrician. It should be a happy discussion. It should be an informed decision making. तो बिकॉज आजकल हर कोई गूगल करता है तो बहुत क्वेश्चंस आते हैं, और गूगल पे एक वेरिड इंफॉर्मेशन होता है तो और कंफ्यूजन्स भी आते हैं। तो मुझे लगता है एक ओपन डिस्कशन होना आपके डॉक्टर के साथ बहुत जरूरी है। इन सेशंस का इम्पोर्टेंस भी एक्चुअली यही है कि आपको सही इंफॉर्मेशन मिले, आपके डाउट्स दूर हो पाए और आप अपनी जर्नी में आगे एक सही इंफॉर्मेशन के साथ बढ़ पाए। So we are there to give you right kind of information and hope that helps you, and you are all able to enjoy your pregnancy and deliver happy and healthy babies.
Thanks a lot, doctor. Thank you for the informative session. Thank you everyone for watching Apollo session today. Stay tuned to the page for more sessions. Thank you, doctor.